Yes. Hi, everyone. Thank you so much for joining our webinar. Sorry, we kicked off a little bit late. We just wanted to give a chance for some people to log on. It's a real pleasure to be organizing this webinar as part of the A Chance Association efforts to raise awareness for childhood cancer. Maybe you did know, or maybe you didn't, but September is the month when we try and raise awareness for those families who are going through a young child in their life who has cancer. So I'm very fortunate to be presenting here or introducing Dr. Roula, who is my son's oncologist. She asked me so kindly to start the introduction because my son was diagnosed with brain cancer in February. I think it's important as a parent to know that there are lots of signs that you don't know. Sorry.
Yeah.
Sorry, guys.
You're amazing. This shows how the mothers,
heal
and how the mothers struggle.
Yeah, Matteo was diagnosed in February, but he was having all kinds of symptoms for 3 years. And we didn't know what was going on until finally in February, the symptoms were so magnified, and he was basically sleeping all day, missing school, and we did an MRI and it showed that he had a brain tumor. And thus began our journey. So with that, I think it's just important to tell you that there are some early signs, and it's good to just keep your eye out for it. So thank you for listening to my story, and now I'm gonna turn it over to Dr. Roula. Thank you.
Well, as you can see, it's very touching to hear Mayuksi's story and to see how she came along with the diagnosis, finished her treatment, and everything is great now with her son. So as a parent, as a person in the society, as anybody, we really need to know what is it that is actually cancer in a child. Because childhood cancers, it's true, they are curable, but often the symptoms are missed, and the learning about the early signs is very, very important to each one of us. Now, what I really wish is I wish I could actually stand here today and tell you we found a cure for cancer, there is no more cancer in the world, and this is where we are right now. But the reality, in fact, is different. There are still, every year in Lebanon, 300 new cases of children less than 18 years diagnosed with cancer, and about 8,586 adult cases per year. And this is according to the National Cancer Registry of Lebanon Epidemiology Surveillance Program of the Ministry of Health, of the Lebanese Ministry of Public Health. And we don't really have an official registry that's functioning, so we don't have newer data, we have scattered data, but this is approximately what we have, and the numbers are even actually higher. The good news, however, is that most childhood cancer types are being curable. And if you can look at these curves of survival, you see in the 1960s how survival rates were in the range of 20 to 40%, and how now in the years 2000, survival rates for all types of cancers have reached 85 to 90%, which is amazing. So when it comes to health in general, it's better to prevent than treat, and all diseases can be treated more efficiently if diagnosed early. In the diseases that can be prevented, if you look at the list of medical diseases that can be prevented, there is obesity, there is hypertension, there is diabetes, vitamin deficiencies, heart disease, infections, but there is also cancer. So cancer is also on the list of diseases that can be prevented. And this is, we're talking in general and not just about childhood cancer. So what I will do in the next hour or so is to just give general facts about what is cancer, talk a little bit about the causes of cancer, answer the question whether cancer can be prevented, and then do a quick overview of childhood cancer. What are the early signs in children? Which symptoms are the ones that are most frequently missed? What are the most common childhood cancer types that we see in Lebanon? And if you suspect a child you know has cancer, what should you be doing? And then I will leave 15 minutes for questions at the end. And Dr. Paul-Henri Torbay, who is the Vice President of CHANCE, will join me at the end to both of us answer some of your questions. You can type in your questions already, and Mayuksi will start compiling them, and we can answer them at the end. So what is cancer? Cancer means that some of the tiny cells in the body are growing too fast, and there are too many of them. Cancer cells are abnormal cells. They are bizarre, and they don't listen to the normal control systems of the body. So they grow nonstop, and they can go everywhere in the body. So why people develop cancer, we don't know. We don't know all the clues yet about what makes it happen. So doctors and scientists are studying and learning more each day about cancer. Is it ionizing radiations? Is it electromagnetic fields? Is it genetic? Are there some types of infections, viruses, chemicals, pesticides, diet? So what is true and what is fake in all this information? The other question that always comes up to our mind, can we catch cancer from people who have it? No, cancer is not contagious like the cold or the flu or the corona. I know everybody's now worried about the corona. One person doesn't give it to the another. And you cannot cause it to happen to someone else. And if your child or a child you know has cancer, it's not your fault and you didn't cause it. So the causes of cancer are variable. There is certainly a genetic predisposition, and we will talk about that in 1 second. The obesity and the lack of physical activity can increase the risk of cancer. A certain lifestyle and sexual behavior can increase the risk of cancer. And also environmental factors, which are sunlight, UV exposure, chemicals that we find in the water, in the air, in the food, and in the workplace, radiation, infections, unhealthy diet, smoking, alcohol, and certain hormones. So what is, when we say the environment can cause cancer, what is the environment? Is it forests, oceans, or mountains, or trees? No, the environment is everything outside the body that enters and interacts with the body. And believe it or not, 2 in 3 cases of cancer, 67%, are caused by the environment. Not necessarily childhood cancer, but we're talking about all cancers in general. In terms of environmental factors which can cause cancer, the ones that are proven are the ionizing radiation. For example, the antenatal radiography, which has now been replaced by ultrasound, can cause cancer. Natural radiation like gamma and radon. Preconception exposure of the father may lead to leukemia and lymphoma in the child. Non-ionizing radiations like ultraviolet radiations from sun, electricity and electromagnetic fields, certain type of work exposures and occupations, but also infections that come from the environment. EBV, human papillomavirus, which can cause cervical cancer, hepatitis B, and which can cause liver cancer, and Helicobacter pylori, which is a type of bacteria that we find in the stomach, which can cause also stomach cancer. Also in the environmental factors which can cause cancer, UV rays, the tanning beds, the sun lamps, etc., can cause skin cancers. The air pollution, the radon, excessive alcohol consumption, even second-hand and third-hand smoking, of course, first-hand smoking, pesticides, which can be found in the vegetables, benzene, some cleaning agents, arsenic that can be found in drinking water, and certain types of unhealthy nutrition. Smoking, I always focus about that because there is a direct relationship between smoking and several cancers. And there is a cumulative effect with the total number of cigarettes. The earlier we start smoking, the worse it is, and the more we increase our risk of cancer. Both active and passive smoking cause cancer. And also, even if we stop smoking one day, we do not erase all the years that we have smoked, in the past. So multiple cancers are caused by smoking, and it's not only lung cancers, it's also cancers of the larynx, the oral cavity, pharynx, esophagus, cervix, kidney, bladder, and even blood. So different types of cancers can be caused by smoking. So look at these and see the effect of smoking on the lungs. And this is a healthy lung, and this is the lung of a smoker. And you can tell right away that this is not going to be good and it's going to cause cancer. Unhealthy diet, eating fat, eating fast food, eating fried food, eating food that has been overcooked, that has the meat, for example, that has been overcooked, that has this black part on it, can cause cancers of the mouth, throat, larynx, esophagus, but also breast, colon, and rectum, kidneys, pancreas, multiple myeloma, non-Hodgkin's lymphoma. All of these can be caused by an unhealthy diet. So what should we be eating? We should eat all these vegetables that don't taste too good. Broccoli, cabbage, cauliflower, and all this family of what we call cruciferous vegetables. Why are they good? Because these foods contain high levels of healthy phytochemicals, which such as indoles, sulforaphane, lutein. These products help the body eliminate all the toxic chemicals and the carcinogens and can be protective against cancer and can stop the growth of cancer cells. Vitamin C rich foods are also very helpful. They eliminate free radicals. They can attack, they can actually protect DNA from being attacked. Once the DNA is attacked and unstable, this can trigger cancer. Vitamin C also acts as an overall immune booster to help actually fight infections. So eating the right food every day can actually lower your risk of cancer. You need at least 5 servings a day of fruits and vegetables. You need to eat plenty of whole grain foods, and you need to be eating low-fat foods. In the US, because of the fast food epidemics that was going on, there have been many actually ads and posts about eating vegetables. Here you can see the typical fast food box of French fries being replaced by carrots, and mottos like "we'll do anything to get you to eat the right food," and also how to start a food fight, working on children getting healthy snacks at schools, getting moms to serve their family healthy foods that is rich in vitamin A and C and fiber and low in fat, because there have been lots of obesity everywhere because of the junk food, because of the lack of activity. Lots of people are getting overweight and getting unhealthy, and the risk of cancer in adulthood has increased. Also, the sun. We are a sunny country. We have lots of sun in Lebanon. It's true that we are people that like to go outdoors and we like to sit in the sun. And eating right will take care of our inside, but we also need to take care of the outside of our body. So protecting our skin always, 24 hours a day, all seasons, from the damaging effects of the sun is very important. Research has shown a strong link between sunburns that children get during their childhood and increased risk of melanoma and skin cancer later on in life. So if we protect the skin from the sun during childhood and adolescence, is very important, because there is an 80% reduction of the risk of skin cancer in adulthood. The worst time for the sun exposure is between 10 a.m. and 4 p.m. And the American Cancer Society and all the cancer societies have recommended to wear protective clothing all the time, use sunscreen that's SPF 15 or higher all day long, and plan outdoor activities trying to avoid midday sun. So just to remember this, there's a nice motto that's slip, slop, slap. Slip on a shirt, slap on a sunscreen with SPF 15 and plus, and slap on a hat before going outdoors, and wrap all your look with sunglasses. Finally, everybody asks about vaccines. Are there vaccines that can prevent cancers? Well, going from the statement that some cancers can be caused by infections like hepatitis B, like Epstein-Barr virus, which can cause infectious mono, which can cause lymphoma eventually, Helicobacter pylori, which can cause ulcers in the stomach, but can also cause stomach cancers, and HPV, or the human papilloma virus, which can cause cervical cancer in girls. There are vaccines that are available for hepatitis B, and therefore once we are vaccinated, we can prevent hepatitis B infection and then prevent liver cancer. And there are vaccines available for girls starting the age of 12, 13 for HPV, which can prevent cervical cancer. And vaccination is recommended in teenage girls, not because they are going to become sexually active at this age, but because the immune system is strong and they will mount an immune response that is stronger and will last longer and will protect them from cervical cancer in adulthood. Cervical cancer is transmitted through sexual contact. It causes abnormal changes into the cervix, and most women who are infected with the virus will never have any symptoms. And it's one of the #1 killers in cancer of women, and it can be prevented by vaccines in childhood, and it's not inherited. So basically, everything that we do in our life, in our lifestyle, can cause cancer. So for our teenagers and our young adults, 20 is the best age to avoid having cancer at age 30, at age 40 and 30 and 50 and 60. So the lifestyle of our children now can help them prevent cancer later on in life. But would it help them prevent cancer in childhood? The answer is really no. But the good news is that the environmental factors that are linked to cancer deaths can be modified. If we change our lifestyle at an early age, we can decrease our cancer risk in adulthood. So just to sum up, how to prevent cancer: getting enough exercise. We recommend 30 minutes of regular moderate exercise per day, eating the right food, avoiding smoking. Better is not to start smoking at all. Even if you start smoking and then you stop later on, as we said, the number of cumulative cigarettes and the number of smoking that you've had will never be erased. Vaccination that's available for certain types of cancer prevention, avoiding sun exposure, especially between 12 and 4, regular medical checkups, and always awareness regarding health-related issues, which is what we are doing today, which is healthcare awareness. So how about childhood cancer? We had a general overview of how to prevent cancer in general. What is cancer in general? How to prevent cancer in our adult life. How about childhood cancer? Cancer is still the leading cause of death from illness in children. So this is still a big problem. The number of children and adolescents diagnosed with cancer in Europe every year is 35,000. The number of children that die from cancer every year is 6,000. Before the age of 15, 1 in 440 children will develop cancer. Plus 13% is the increase in childhood cancer rates between 1980 and 2000, and it's still on the rise. However, the good news is that 80 to 85% of children with cancer can be cured completely and lead a normal adult life. The other good news is that childhood cancers are much more frequent than adult cancers. 98% of cancers develop in adults, and only 1 to 2% of all cancers occur in children. So we consider childhood cancer being rare. In Lebanon, as I said, there are no official yearly statistics, but the Ministry of Health has done scattered statistics, and we know that we have at least 300 new cases per year. The types that occur in children are different than the types that occur in adults, and cancer in children is more curable than in adults. For a cure and to optimize chances of cure, early diagnosis is really critical, and this is why this webinar that we are doing now is so important for every person. As I said, there are different types of cancer in adults and children. So what you hear about adults, adult cancers does not necessarily apply to children. So in children, you see leukemia, you see lymphoma, you see neuroblastoma, you see brain tumors. In adults, you see lung, breast, prostate, or colon cancer. So it's completely different types, kind of. The most common type of childhood cancer continues leukemia, or cancer of the blood or the bone marrow, and it's also the most curable type. In Lebanon, as we said, we have about 300 new pediatric cases per year. The mean age is about 5 to 6 years, but the age range is between 2 months to 18 years. It affects equally girls and boys, and it doesn't spare anybody. It affects people from all socioeconomic statuses. In our statistics from Lebanon, 22% of the patients had a high socioeconomic status, 51% had a medium, and 27% had a low socioeconomic status. So it doesn't matter what part of Lebanon you come from or where you are from, it can affect you equally, and this is the same statistics all over the world. So this is again, our data looking at the distribution of the patients in Lebanon. So 27% of the children came from the north, 24% from Beirut, 22% from Mount Lebanon, 14% from the Bekaa, and 13% from the south. It doesn't mean that we have less in the south and the Bekaa. This is just kind of to give us an idea about the distribution of the cases, and so that we know that we have cancer cases that come from all over the country. So why children get cancer? They have a healthy lifestyle. They didn't yet get in contact with the environment yet a lot. What are the causes? Is it the ionizing radiations? Again, is it the electromagnetic fields? Is it genetic? Is it inherited? Is it infections or viruses? Is it the chemicals that they are putting in our food or the pesticides that we find in the vegetables? Is it a certain type of diet, or is it again living in a certain lifestyle? Well, heredity is a bit important in children. Inherited predisposition to cancer is an important cause, and it's becoming more important as research is improving. There have been several cancer predisposition genes which have been described in children associated with certain types of cancer. And there are now recommendations available for a large number of families and syndromes which are known to predispose to cancer. So why it is important to know if there is a cancer predisposing syndrome in the family? Because there is something that we call cancer surveillance, which is doing exams and tests to detect cancer early. Because if we have an early detection in people who have a predisposition to developing cancer, higher cure rates can be achieved if the diagnosis is made early. And also these children or these patients or these families who have multiple cases of cancer, they require a special treatment that needs to be adapted to them. And we know today in 2020 that there are many children with cancer who have yet an unrecognized familial inherited predisposition to cancer. This is why when we take the family history, it's important that we tell the doctor if we have other cases in the family, if we have consanguinity, meaning that we have cousins married among each other, and especially if we have cases that have occurred in childhood, cousins or family members, especially if we have family members who have had cancer at less than age 45. So we don't do genetic counseling or genetic testing in every child with cancer, although it might become part of the more recent protocols. But what we do is we take a very good family history, going through 3-generation pedigrees. And if we have more than 2 malignancies, more than 2 cancers in family members before the age of 18 years, including the child that we are looking at, or if we have a parent or a brother or a sibling with a current history of cancer before the age of 45, or if we have more than 2 first or second degree cousins in the same lineage who had the cancer before age 45, or if the parents of the child with cancer are consanguineous, meaning they are married to each other. And I want to remind you that Lebanon and the Middle East, we still have very high consanguinity rates. Do you know how much are our consanguinity rates in Lebanon? They are about 35%. Looking at all Lebanon, still we have 30 to 35% of people that marry their cousins. And also there are 55 types of childhood cancers, which are known to be associated with an inherited predisposition. But heredity is not the only cause of cancer in children, and many times we cannot really find out the exact causes. But what we can do is to know the warning signs, be aware of the early symptoms, and make sure that we recognize them and know them. We always say that there are 8 warning signals of childhood cancer, and we want to know what are these 8 warning signals. And I want to say here that we don't need to worry or get concerned about these warning signs, because as you will see, they are not specific, and they can occur in many other diseases. They can even occur in infections, inflammations, rheumatoid problems. It's actually the recurrence of these symptoms or the lack of improvement of these symptoms with the normal treatment modalities that are concerning. So what are the 8 warning signs? The first one is if you notice that a child is pale, or if he's being really tired. As you can see here, children like to play, they are very active, they never feel tired. So if a child feels like he's really tired, or he's pale, or he's sitting on his own at the side for a long time, then you can be concerned that maybe something is happening, because this is not what a normal child behavior is. Because childhood cancer can have different presentations. This girl, for example, she came in, she was very pale. She just had a lack of appetite for eating, and she was diagnosed with a leukemia. This child came in with nodes on his neck and fever, recurrent fever, and nodes on his neck, and fatigue. So it can have different types of presentation, which could be nothing, and could be important as well. The second warning sign is excessive bruising or bleeding. All the children have bruises. This is not just by itself a warning sign, but as we're talking about excessive bruising or excessive bleeding, especially in areas that are not that are covered and are not really subject to trauma, like the legs, the arms are always subject to trauma. So what do bruising look like? This is a child that came in only with one chief complaint, only bruising. And as you can see, you can look at the legs and you see he's full of bruises. When we did a blood count, the platelets, which make the blood clot, were very, very low. And he ended up having leukemia and having the most common type and the most curable type of leukemia, which is acute lymphoblastic leukemia. This is another child. And of course, all the pictures we show are with the permission of the parents. Had a big bruise here, and he was diagnosed with another type of leukemia, which is acute myeloid leukemia. But we don't want you to worry, because not all the bruises mean that you have cancer. It could be normal childhood bruises, and it could be something benign, like this child, for example, who had bruises also and petechiae, which are the small, tiny red dots that we see on the legs when a child has low platelets. But these do not necessarily mean cancer of leukemia. They do here in this situation mean low platelets, but it was a benign disorder, the most benign platelet disorder, which is called ITP, or immune thrombocytopenic purpura, and it's not a cancer. Of course, it's very scary to see them, and the child has to be examined and tested, and we might have to do something called a bone marrow exam, but it doesn't necessarily mean that it is leukemia. Also, increased swelling or persistent pain in the bones or the joints is also worrisome to look for a tumor. Headaches with vomiting in the morning. Children don't have headaches. When they wake up at night with headaches, this is very concerning. If they vomit in the morning, early morning vomiting, headaches at night, headaches waking up the child from sleep, is concerning for mainly a brain tumor. And I will talk about that because brain tumors are the ones that are being missed the most and where we have lots of delays in diagnosis. Here, if we see a lump or a mass in the abdomen, in the neck or elsewhere, it's very concerning. Sometimes the child is very healthy, the mother is giving a shower, and then she finds a lump or a mass in the child's abdomen, and this has to be examined and tested right away. This child, for example, came in with a big node here on the neck. And this is very, very common because a lot of children come in with neck bumps, with lymph nodes, and it doesn't necessarily mean that it's a tumor. But look at the size of them. They are on both sides. They are very big. And when we touch them, they are firm, they are hard. They are not the regular lymph nodes that all children have with a minor infection. And this girl ended up having a big tumor inside her nose and what we call a nasopharyngeal carcinoma. And these lymph nodes were metastases from the tumor that is in the nose. She had a blocked nose, she had decreased hearing, and all these were symptoms of something happening that's more serious than just a simple infection. Continued unexplained weight loss. This is the next symptom we should be worried about because children should be eating and gaining weight and should not be losing weight. So any child who is losing weight with no explanation should be explored and should be tested for a potential tumor or cancer happening. Recurrent fevers not due to infection. And I insist on this point, not due to infection, because again, we don't want to panic every time our child has a fever, because still the most common cause of fever is infection, all kinds of infections. We can even have infections with lymph nodes. We can even have infections which cause our white blood cells to be very low. We can have infections which can cause our platelets to go low. We don't have to really right away think about cancer, but it's mainly recurrent fevers in the evenings, multiple infections, multiple courses of antibiotics, not getting better, a child deteriorating. It's actually the worsening of the clinical situation of the child that is more worrisome than the recurrent fevers themselves. Another symptoms that can be missed, and I will tell you in 1 second the story of one child that we saw recently, is the development of a whitish appearance of the pupil of the eye. And this is what we call leukocoria or cat's eye. You take a photo, and in the photo, instead of the eyes of the child the pupils looking black or dark, they look whitish. And this is like if there is something obstructing the pupil because there's a tumor happening in the retina, which is called the retinoblastoma, which is also common in our part of the world and is often missed and often misdiagnosed or missed because we don't really notice, or sometimes the child is crying, doesn't open his eyes. I want to tell you the story about a beautiful boy called Eli. He came in with the parents noticed on both eyes that there is a bit of a swelling, redness, and that he is moving his eyes in an abnormal way. He was admitted because to a governmental hospital, where they thought for 15 days that he just had an infection of his eyes, but he kept on getting worse, and the parents kept on noting that he cannot see, and he keeps on getting actually worse. And he was having these symptoms for about a month or so. So then finally, he was discharged from the governmental hospital and went to an ophthalmologist, which saw immediately that the eye was abnormal and there was opacity in the pupil, like I showed you. So he suspected the tumor retinoblastoma and referred him to us. And we did immediately the eye exam under anesthesia, because we have to open the eye very well. And we looked at the retina under anesthesia, and we looked at an MRI to make sure it's not going inside the brain. And we found, unfortunately, tumor in both eyes. We were able to salvage one eye, but the other eye, it was too late, and he could not see anymore, and we had to sacrifice this eye. And successfully, we put a prosthesis. He received chemotherapy, and now he can see with one eye. And we'll show you in the next webinar, hopefully, his picture and how he was salvaged. Now, if we leave this tumor undiagnosed, he could have lost vision in both eyes. The tumor could have gone to his brain, and he could have affected his whole life. So this is why early diagnosis, suspicion of cancer, warning signs that everybody should know can save a child's life. You can notice, in a picture, you can notice when you see someone else's child, you can tell them, because sometimes the parents cannot be objective. Although here the parents were actually suspecting that there's something abnormal, but there was a bit of delay because they couldn't get to a specialist right away. So just to sum up the warning signs of childhood cancer, we put them under the mnemonic of chance, like that: continued unexplained weight loss, constant infections or recurrent or persistent fevers of unknown origin, headaches, often with early morning vomiting, increased swelling or persistent pain in the bones, joints, back or legs, a lump or a mass, especially in the abdomen, the neck, the chest, the pelvis, or the armpits. A is for a whitish color behind the pupils. N is for non-traumatic bruises. C is for constant tiredness or noticeable paleness. E is for eye or vision changes which occur suddenly or persist, which can be also a symptom of a brain tumor. So what symptoms are most often missed? It's actually the brain tumors. I think from my experience, still delayed diagnosis. The brain tumors are the first solid organ tumor in childhood. It is the second most common cancer after leukemia. 20 to 30% of cancers in children are brain tumors. In the US, there are about 3,000 new diagnoses per year, most of them occurring before the age of 10, a little bit more in boys than in girls. And in terms of survival, they are the ones that have a little bit less good outcome compared to other types of cancer. And part of it, it's because of the location. We cannot always operate. And sometimes because of the type, and sometimes because of the delay in diagnosis. And there are over 100 types of different all sorts of brain tumors, and these are the ones that can sometimes present with this huge mass that has no symptoms, and it can be pretty big before the people come in. So just the warning signs of brain tumors, because it's very important, can be early morning headaches, vomiting, projectile vomiting, any weaknesses or deficits, sudden onset of strabismus, meaning that يحول عيونه, strabismus, or it's change in vision or seeing double, or a head circumference that the pediatrician takes in every visit that's rapidly enlarging. But also, and this is why we can miss them, it can be subtle, like change in personality, change in sleep, irritability, change in school performance. And I insist on this one: a child who was grade A student, and then all of a sudden his grades are falling apart, and the teacher thinks he's lazy or he's sleeping in school, and sometimes it's just that he's developing a brain tumor. So what the international medical community did something called Head Smart, be brain tumor aware. And remember that the brain tumor symptoms can include persistent or recurrent vomiting, problems with walking, balance, coordination, abnormal eye movements, behavioral changes, particularly decreased energy, sometimes seizures, or sometimes just tilting of the neck. So this requires an urgent referral, especially if there are 2 or more of these symptoms. And here in this situation, ask for an urgent referral to a specialist. So what to do if you suspect a child has cancer and how to make a quick diagnosis. So here we suspect the mass, here we suspect leukemia, then we need to do imaging and we need to do lab testing. And this is very important not to delay these. And avoid the spread of the tumor. Look at this, for example, it was really so big, compressing on the kidney, this is the liver here, with metastases in the liver. All these white things here in the lung and this child are metastases. This was very advanced stage. So in order to avoid the spread, it's very important to make an early diagnosis. And here I will speak a little bit about Chance Association that's organizing this, where you can actually refer the patients or ask for help if you know somebody who cannot afford doing the initial testing for the diagnosis. So Chance has started in 2002 because of the story of one child who was not able to afford care because of financial means. And it was started by doctors, parents, and volunteers, and it provides support to children with cancer and blood disorders whose families are not capable to cover the expenses of medical treatment. It relies on volunteer work and donations, but it also supports all the children, even if they can afford their care, in terms of psychological support, activities, accepting the disease. The mission of Chance is to provide equal access to care to every child, avoid delays in diagnosis, and it relies only on fundraising projects and events to cover the cost of chemo and radiotherapy at actually 8 hospitals in Lebanon. So far, Chance has covered the treatment of over 800 families with about 80% cure rates. It has covered about 15,000 hospital admissions and outpatient procedures. And in 2015, it has created the first cancer survivor group in Lebanon. It has been selected as a top finalist for the Best NGO Award in 2015 for Health by the United Nations Development Programme and Quality Systems International in Paris. And the major achievement of Chance is to cover the cost of treatment in several hospitals in Lebanon without asking for more. And the other major achievement is that thanks to Chance, no child is refused medical care because of financial limitations at all. It also provides moral and psychological support to the children. And here I would like to give a tribute to our nurses for their dedication and our volunteers. This is Teta Salam. She's one of our oldest volunteers. She is 85 years old. Now she cannot come to the hospital because of the corona. This is a picture that was taken before and the children miss her. She saw us on a TV show one time and she decided to donate her time. And this is the spirit of Chance, where you are donating and giving, your time. But Chance organizes activities to the children every year, Christmas party, Easter egg hunt, which are all now being missed by the families because we cannot do gatherings. And mainly part of our mission is to raise awareness and call to action. Chance has organized several awareness campaigns. In 2013, a campaign with universities and schools about a healthy environment for a cancer-free world. In 2016, raising our voice against childhood cancer. And in 2019, the Operation Ribbons of Hope, who actually engaged children in schools to a nationwide campaign to promote the early signs of childhood cancer in the whole country. And now September is Childhood Cancer Awareness Month. And this is one picture taken by Marta, who was our coordinator for the school project in Sankar school, which was my school when I was a child, actually. And I came back to it as I would say, as a physician, when we were, these school students dreaming about their future and not knowing what they will do. Childhood Cancer Awareness Month activities in September. This is what we are doing now, is this awareness webinar. We have also done in Chance awareness cards in 3 versions, Arabic, English, and French. And we have issued also medical booklets, which we can obtain, of course, by contacting Chance Association. And this is our lovely Serene from our webinar post. She came to my office last week, and look how she is, gorgeous, cured, and happy. And she wanted to share this picture with you and share her story. And I don't know if she's logged in and listening to us. Just for us to end on an optimistic note, we need to know that after cure, children can lead a normal life, and you cannot tell who was the one affected and who was not. We have many inspiring stories of survivors of life after cancer, and the thrill of the fight is to find light in the darkness. Ramis is one of our survivors. Here is one of our events with the two Miss Lebanon doing our wearing origamis. The origamis were made by the children in the hospital. And Ramis, from being a cancer patient, he became a medical student, and he's now almost completing his medical school, and he's going to be soon a doctor and a colleague, and he wants to dream of being an oncologist. And this is Youssef. He's also one of our survivors. He came with me to Jordan on one of the meetings that we had there, and he climbed all the stairs, running all the way up, and he made me, think that really the sky is the limit with what these children and these people can do, and the sky is the limit with what the volunteers of Chance and the dedicated team can do. And here I would like to thank Mariuxi. Here she is here. She is the mother of a survivor. She is a hero. She dedicated her time to improve Chance communication, let the message of Chance be heard all over the world. I would like to thank her so much for her efforts, and also thank Carl and Alain, our husbands, who are, tolerating our absences just to do more work for Chance. I would like to thank Sandy, our Chance assistant, who's done an amazing job through all these years. And this is Marta, who is also our communication expert. This is the crisis management team of Chance. And here, how to communicate with us. You can follow our Facebook, Instagram page, and our website also. And here, just a note to all the volunteers. And I think Dr. Paul-Henri Thorbey, the Vice President of Chance, is here with us, and we can both answer questions. And I want to thank you so much in all languages, because I know there are people from all over the world logged in to our webinar. Thank you so much for your attention. And I think it's time for questions. I hope I was able to provide the message and give you an overview. I'm right on time, 7:46, 15 minutes for questions. They can.
Thank you very much, Roula, for this very clear.
We can actually answer some of the questions, and you can also, if you like, to unmute yourself and ask a question. You are more than welcome to do that as well.
So, doctor, someone asked, may keto increase the risk of cancer?
May keto diet increase the risk of cancer? Okay, Paul-Henri, would you like to answer this? If you can unmute yourself. Dr. Thorbey, are you here?
Yes. I don't know if you can listen to me, if you hear me. There's not any evidence that keto diet does.
Can you hear Paul-Henri? There's a question from Abid Shafi about may keto and keto diet increase the risk of cancer? I don't think we can hear Paul-Henri. Maybe I will answer. Keto diet in terms of being rich in fat and proteins can increase a bit the risk of colon cancer if it's unbalanced and if it's taken for long periods of time. Although there are no real scientific data specifically about keto diets. Can they hear me? Yeah. Can you hear?
Hello?
Hi, Paul-Henri. Yes.
Yes. Sorry. I tried to talk, but to speak, but you couldn't hear me. I wanted just to stress on this keto diet. It might be not very healthy for children in general, actually young children, but as far as cancer is concerned, there's no real risk in childhood to develop more cancers, childhood cancers, following keto diet. But this is not really a big issue in children, but keep in mind that keto diet is not designed for small children because it's an unbalanced diet and it's not really what's advised by the nutritionists. Can I ask a question, Roula? I don't know if you can hear me.
Yes, I can hear you.
Okay. When a child is diagnosed with cancer, very often parents are very worried about their other kids, and they ask if there are any tests to be done to the siblings of this child. So usually we tell them that there are not so many tests that we can do. All what we can do is to be ready to detect very early symptoms. But are there any tests that can be done to siblings of a child with cancer if it's isolated cancer without any family history?
Okay. I'm glad you raised can you hear me, everybody?
Yes.
Okay, great. I'm glad you raised this issue because yes, it always comes up with parents. You know, this question, it always comes up. Actually, for twin siblings, if there's a twin, there's a 30% increased risk of cancer for the other twin, even if it's just an isolated case in the twins. So the twins should always be examined. Now, there are also genetic syndromes which predispose to cancer, like Down syndrome or trisomy 21, like Fanconi anemia, like neurofibromatosis, etc., which are general, I would say, syndromes that can that have a tendency to develop cancers in the affected member or in other families who are affected as well. But now, in terms of just one isolated case of a child having cancer without any family history at all, like there is no family member that is less than 45 years that has cancer, there is no other cousins or no first-degree cousins who have childhood cancer, there is no consanguinity in the family, then there is really, the risk is really minor. If you know, there are the criteria that I showed, which are now documented in tools, and in the new protocols, there is something that will happen in the new cancer protocols for children, which is called the trio sequencing. Trio sequencing is where you take the child with cancer and both parents, and you sequence the whole genes of the three of them. Trying to find any abnormalities on a large number of people, trying to see if there's any genetic component, and then if there is, then you can test the siblings. But to answer your question, what we can do now these days. So now we have to take a very good detailed family history going over 3 generations. And if there are any of the criteria that I mentioned, there's a questionnaire that is now documented, that is published now, 2019, 2020. There's a questionnaire that we ask many questions to the family, 3 pages. And in Europe, they are doing it for every child enrolled in a protocol. And if there are a set of questions and like a score, and if the score is high or positive, then you have to test this family and test the siblings and the parents. And if the score is no negative, meaning that there is no scientific evidence that there is a familial cancer gene or inherited tendency, then we do not test. There is no need to test neither the parents nor the siblings. I hope I answered that.
Yes, thank you, Roula. I don't know if there are any other questions.
We have doctors. We have Dr. Mitri Aida. We have some pediatricians with us. If you like to also make some comments. I see we have Dr. Huros. She's a pediatrician. Jessie, would you like to make any comments or questions? Ask to unmute.
Doctor, it's
Yes.
Majd, if I can ask a question.
Yes, sure. Hello, how are you?
I'm good. It's about the HPV vaccine.
Yes.
هلا we've seen انه الفوكس تبع ال HPV vaccine is mainly على ال females for cervical cancers. But do you think that it's also important to cover men as well, كرمال the rising risk of head and neck cancers, that can be found in both men and women?
Absolutely. This is a very important question. Yes, I had more slides on HPV, but I didn't go into the details because you can talk an hour about that. Now, definitely it's recommended to vaccinate both boys and girls, because boys can also have penis cancer. They can also transmit infections to girls. And now more and more countries like Australia, Canada, the US, and many countries in Europe are making the vaccine mandatory for boys and girls during the teenage years. And they are looking at the number of doses. If you are less than 15 or more than 15, if you can take 2 or 3 doses only, and if you still have protective antibodies when you're an adult. But yes, your question is very relevant. Boys and girls, it started with girls and women, but definitely boys also should get the vaccine. Yes. Good point.
Thank you, doctor.
Thank you much. Irene, you like to say something? Fadi, I see Fadi here. Thanks to all who attended. It has been a very, I hope it was interesting to you, and it's been a pleasure to see you all.
Hi, Doctor.
Hi, Serene.
I just want to say thank you, and thank you to Chance for this useful thing you did.
Mm-hmm. Thank you, Serene.
Doctor, I just want to say that see you also in terms of time. I don't know if for boys, the testicles, any change in shape in the testicles or size might be something to look for.
Yes, very good point. Yes, testicular tumors can occur in children by itself. It can be germ cell tumors in the testicles, and germ cell tumors can occur in the testicles, in the ovaries, and even in the brain. You can have also benign tumors in the testicles, and also you can have enlargement of the testicles in boys who have leukemia with extramedullary, like extramedullary meaning if you have involvement by the leukemia cells outside the bone marrow, which is the brain and the testicles in boys. And it's very important, I'm glad you raised this point, it's very important for pediatricians and doctors to undress the children completely when they want to examine them, and examine the testicles, also examine all the body in girls, you know, the breast and the testicles, and teach boys how to do self-testicular exam. We see lots of young boys and young men who have testicular tumors other than the ones that occur in childhood, seminomas and other types of testicular tumors. But they are sometimes worried, or they don't know if it's normal or abnormal, or how big the testicle should be. And you can also have enlargement of the testicle from water, from having water in the abdomen, like ascites in your abdomen, from a tumor compressing the lymphatic return, or the pathways in the abdomen, and they don't know. I remember a child now that you mentioned that we saw like that. He was 14, and he was ashamed to tell his parents about this finding, that he thought it was his puberty still ongoing, and in fact it was a compression of the lymphatic pathways, and it was a secondary problem to his tumor. Yeah. Jessie, Dr. Haros, yes. Hi, Jessie.
Hi, Roula. Are you hearing me?
Yes.
Yes. Very interesting webinar.
Thanks a lot.
Just one question. A few months ago, I read an article about sunscreen.
Yes.
They said that they do not know till now how much we should put sunscreen in order to avoid cancer, because they said the absorption of sunscreen, if we put too much, okay,
Yes.
they said it might be a risk of skin cancer after many years. So what is your opinion about this?
That's a good point. Paul-Henri, can you comment on this point also? Dr. Torbay, are you still here? Maybe he lost the connection. It's interesting, Jessie, what you are mentioning. It's interesting what you're saying. Maybe putting too much can flip over to the other side. Now, I think the being moderate in everything would be reasonable. Probably, some people say SPF 50 and more. The American Academy recommends SPF 15 and more. You see sometimes SPF 3 or 5. These are completely useless. I would say if you really want to protect your skin from cancer, you need 50 and more, and you need to avoid being exposed between the times of 11 and 4 or 12 and 3, which are the peak times of the sun. And you are talking about putting a large amount. What's the article? Or
yes,
putting
exactly. They do not know. They do not know till now how much we should put over the skin to protect from skin cancer. But on the other hand, they said if we put too much, it will be a risk to develop a kind of cancer afterwards.
Yeah.
Yes.
We need to watch that. Look at more articles. Watch more of them to get more scientific evidence that it's really proven. You know, that way. But it's a good point to watch for. So don't overdo anything. Basically.
Exactly.
That's the last.
That's
Not
I will touch that.
Not to overdo anything.
If I can add an answer to this question,
Sure.
usually creams, medical creams, are tested for a long-term use, and usually they test for teratogenic and carcinogenic effect. So usually they are safe, even if you put a big amount. So better putting big amounts than small amounts to avoid sun exposure. So don't be afraid about big amounts. They are really very rarely toxic.
Okay.
I think it's about time, right? One more question. Okay.
Hi, doctor. Someone asked, okay, someone asked, how can they volunteer with Chance if they are under 18?
Okay. If you are under 18 and you like to volunteer with Chance, sure, you are more than welcome. We do not allow hospital visits or visits of your patients on your own if you are less than 18, but you can come with the doctors. We are in 8 hospitals, and you can sure come and volunteer with us if you would like to be in contact with the patients, but we are not allowed to be alone with them, and you need a bit of training before. But you can certainly come to Chance office. There is lots of computer work, organizational work. You can participate in fairs, you can participate in events, you can participate in our webinars. Yeah, there are many things to do, many things. And now we are with this crisis that we are living after August 4 and the crisis management unit, we are under a lot of pressure, and we need a lot of support from everybody who has a talent or anything to offer is more than welcome to volunteer. There is plenty of room and plenty of things to do. Yeah, and you can write us and contact us by email or write on our Instagram, and we will reply to you and we get you in touch with us.
Hi, Dr. Roula.
Hi.
This is Mateo.
Hi, Mateo. Hi, Mateo. That's a nice surprise. Hello, Mateo.
Yeah, I'm watching.
I'm watching.
Are you watching us? Okay, okay. I hope we did a good job explaining everything. Mateo is my son, and he's our star. I hope you are proud of us, Mateo.
I am.
Okay. You would like to say something? How do you feel as a hero, after undergoing all this? How do you feel? Is there something you'd like to say to the other parents, doctors, family?
It feels way better.
Yeah.
And it's a relief. And so thank you for all of your support also.
Oh, Habibi, you are wonderful. We are wonderful, Mateo. Thank you for being with us. That's a nice surprise. And I hope when you grow up, you will become a volunteer also with us, like other children who volunteer who become. Nadine, would you like to say something?
This is Talia.
Hi, Talia. You are attending too. You guys are amazing. Talia, Talia, hello. Talia is another hero. She is so brave. You are a champ, Talia.
I love you.
Oh, we love you too. You are amazing. You are amazing. You and your parents and everybody.
Thank you.
We would like
Great.
also to thank you, Dr. Farah, for all your efforts and your support.
Nadine, thank you. You are the ones who are the heroes, and you are in the front lines, and you are the ones who are also raising awareness because you lived the experience. Like Bayuksi, Fadi, you are the greatest parents who will teach others with your experience, you know, what to watch for, what it's like to be a fighter and a survivor. At the end, we're gonna all win the battle against cancer, hopefully.
Hopefully. Thank you, doctor.
Thanks a lot.
Thank you.
So I think with this happy note and with the cutest kids, we can certainly end our webinar today. And thank you for all your presence and your support. And I hope you will be part of Chance family and always participate to all our future activities and webinars. Great. Oh, you have someone from Indonesia. Hello, hello, IC. Thank you for logging in. I know you're in a different time frame.
Yeah. Thank you for your presentation. It's very wonderful, and it's wonderful meeting too.
Thank you, Abed. Thank you, Mayuksi. Thank you very much for from all over the world. Thanks a lot. Thank you, Maisa. You want to say something?
So this concludes our webinar. So thank you so much, everyone who's still on with us. But just to let you know, we did record the webinar. I had a few questions about it, so we will post that. And if you have any questions, you can contact Chance at Chance Association on Instagram or Facebook. And the email is chanceassociation@gmail.com. So feel free to reach out. Thank you so much. Thank you, Dr. Roula. And have a great evening, everyone.
Ciao. Ciao.